welcome back to the Pelvis Party. My name is Becky Monpetit. I am the owner of Rochester Local, and I've got two guests with me today. I am joined by Dr. Melissa Richards. She's the Division Chair of Hospital and Surgical Services at Olmsted Medical Center, and Tara Sufferins. She is a nurse practitioner at Women's Health with Olmsted Medical Center. Good morning.
Good morning.
I'm happy to be here with both of you today.
A pleasure. Yes.
Okay, we're going to talk about post-menopausal bleeding.
Yay! Yay! You thought you were done and then it comes back.
Okay, so post-menopausal bleeding is actually not something, it's like not a topic that I have heard a lot in the media or just like in general. But now that I have heard about it from you and like just kind of talking about planning, it's kind of like creeping up, right? Talk to me about it.
Awesome. So postmenopausal bleeding is a passion, I think, of both of ours. So let's define menopause. So menopause, if you have a uterus and you haven't had a procedure or something hormonal done to prevent you from having bleeding, a better definition would be your ovaries aren't working anymore. They've said, thank you, we are done. The average age of menopause is 51. And then if you have an operating uterus, 1 year of not having a period. Okay. So we're going to keep it classic. It's someone who's had periods their entire life, and now they have ceased to have them for a year. Yes. And despite the hot flashes, night sweats, and mood changes, and decreased energy, we're like, yay, no periods! There's a little
win. Is it really
and then you start bleeding.
Yeah. Okay. So then...
And then definition of postmenopausal bleeding
is any bleeding after a year.
Brown discharge, pink discharge, spotting, bleeding like a period.
Okay.
All of those.
So you have had 0 period for 1 year.
1 year.
And then all of a sudden...
it might be wipe and you're like, oh my gosh, that's blood. Or that's weird brown discharge. Or that's something, right? And you're like, what's what? So... not to frighten or scare people. The idea is to empower a person.
Knowledge is power.
That symptom is like a woman finding a lump in her breast. Okay?
Yeah.
It requires an evaluation.
Do not ignore.
Do not ignore it. And I think both Tara and I would agree, we see a load of patients where this is news to them.
Yes, they're scared. A lot of people call and they're scared. I have bleeding. I'm not supposed to be bleeding.
Or they've had bleeding and they're like, I don't know, I've had this for like 5 years.
I got my period back and I just decided to come in.
Right. So I feel like we hit a really important topic there. Is news to a lot of patients is do not ignore bleeding after menopause. You have been 0 bleeding for 1 year and all of a sudden you have some onset bleeding. Don't ignore it. If this is new information, internalize what we're saying here. This is really, really important. It's not
tell
just
10
like,
friends.
Yeah, and tell 10 friends. Like, it's not just like part of the menopause process. This is abnormal. This is abnormal. We're gonna hone in on that. I want you to remember it. Proceed.
Okay. So now we have this bleeding. So we want to understand like why, right? So now I'm going to draw a picture. I have 2 black markers and 1 red marker. Ooh, this black one works. Okay, I'm drawing a uterus. Uterus?
Hold on.
It'd be
I'm going to
uterus.
hold this.
Okay. Oh, thank you.
Yeah, great.
So here is our uterus. Here is our vagina. Let's make some fallopian tubes. Let's make some ovaries. Okay, great. Beautiful. Okay, so why do people have postmenopausal bleeding? Now, statistically, the thought is the most common cause is actually a little bit the tissue inside the vagina. So the canal, the opening that opens into the uterus. So this is a very common place where people will have spotting because that tissue is thinned out due to lack of estrogen. That's a whole nother episode we're going to do at some point about vaginal genital urinary syndrome of menopause or dry vagina. That's another day.
Okay, yeah.
Yep. So fun time. Yeah. Okay, so this is a very common cause of bleeding. We can get the cervix, the face of the cervix. So the face of the cervix. Oh, that's not matching my colors.
Get with a program, Richard.
I know, right?
Yeah.
Exactly. So you can get a little bit of thinning of that tissue on the cervix, or A scary thing, very, very low risk would be some precancerous or cancerous cells on the cervix. So that's there. And then inside the uterus, what I think we see the most of for postmenopausal bleeding, polyps. Polyps are typically benign, non-cancerous little skin tags, and they love to bleed. And this is really common. We see this a lot with our postmenopausal bleeding patients, more I think than the vaginal dryness patients, or that is the cause. That makes up about 80% of people who have postmenopausal bleeding. 20% of patients, however, have precancerous or cancerous cells in their uterus. So we need to identify those 20% of women or people with uteruses who have the precancerous or cancerous cells. Now, uterine cancer is the most common gynecologic cancer. In the state of Minnesota, I haven't looked at the data recently, but our numbers were like twice the national rate.
Oh my, okay.
So this is a big deal for our region.
Okay.
So that's a picture of what causes postmenopausal bleeding. Great.
Yeah.
I'm glad we had
Yeah.
just markers.
I'm glad you took that. It was getting a
Thank you.
little
It was getting a little heavy. So if we have a patient who has made an appointment, this is something where we need to advocate for ourselves also. So if you call and you're like, I need an appointment, and we're like, see you in like 6 weeks, you can say, I need to be seen sooner.
You need to come in.
And you can say that. You can advocate for yourself on the phone with the appointment coordinator. You can say, actually, I have some postmenopausal bleeding. And the person on the phone is going to be knowledgeable, and they're going to say, thank you for telling me this. They're going to see what they can do for you. They're going to say, great. Or you can say, as the person making the appointment, I need to be seen sooner than that.
Absolutely.
And that is where you, as the patient, have the right and the responsibility to advocate for yourself.
Absolutely.
Right? Don't settle. We say that on this series
Big time.
a lot, right?
Absolutely.
Yeah.
Absolutely.
But it's not emergency. I mean, in a sense.
Right.
Yeah.
So we want them to know that. I mean, they might not know it's postmenopausal bleeding. They might
Right.
not
Absolutely.
understand it. So then they call in and say, I have a concern, and it should be,
Right.
they should be seen sooner than later.
Right.
You can always ask to speak to the nurse. You can call, if you're calling your primary care, you can call gynecology. Like, you can call Dr. Richards or
You can
Tara.
message us, and
Exactly.
we will tell you need to come in.
Yes. But it's not a tomorrow visit either. But it's something that we want to see you on a timely basis.
Sooner than 6 weeks.
Sooner than 6 weeks.
Right. I have a question about this.
Yes.
Okay,
recap.
So, recap. Dry vagina. Polyp. Right? Okay.
Yep.
Precancerous cells. When we talk about precancerous cells, is it just precancerous cells that's causing this bleeding? And that there's loads of treatment options that can be addressed before we get to some things that are increasingly more sinister.
Yep.
So, like, when we see this brown wipe, we don't have to go straight in our minds to, I have stage 4 uterine cancer.
Nope.
I have 6 months with my family.
Nope.
I need to start getting my last will and testament together. This is your sign to get a move on to your primary.
That something's wrong.
Something is different.
Yep.
So I think a lot of us women worry.
Absolutely.
Right? We worry.
Yep.
And for a lot of good reasons, right? Because as a society, we have a lot of information at our fingertips.
Yep.
And bleeding and all this sorts of information makes our brains think. But this is precancerous. And so there's a lot of things that we can do. And the point that we need to make in this series is there's a lot that can happen before we get to even stage 1 or stage 2 or stage whatever.
Scary. Yep.
To the scary stuff. So let's address this.
Yes.
Before it gets to the scary
Right.
stuff. Don't ignore this.
Do not ignore this. And so typically, if we have a patient who we're going to see for postmenopausal bleeding, we want to rule out the scary stuff.
Yep.
So how we do that is either doing one of two or maybe a third thing. So an ultrasound. So getting a pelvic ultrasound is very helpful. So we typically recommend getting a pelvic ultrasound. So we look, another picture.
Oh, okay, great.
Okay.
You're going to make me hold it again?
Yep.
Okay, okay.
So ultrasound. we'll at some point maybe do a pelvic ultrasound just in general, but
Live on Pelvis Party?
No. What does that entail?
But what is it? What is it?
Ultrasound.
So
What is
here's
it?
the uterus, and you'll notice something different about this picture is
I don't know why I just did that.
Broke the fourth wall, Becky.
bye, Joe.
See ya.
And cut. Yeah. Bye, Joe.
Okay, so what we have here is we have a uterus, and this is what we see by ultrasound, and we'll see a lining. Okay, so the previous picture that I have, it was like open, but this is not actually what things look like when we do an ultrasound, because
There's a cross section.
it's a cross. Yeah, so this is it's kind of like like a peanut butter sandwich. So it's like smushed together. So there can be things in there, like polyps or other things. But it's what I'm trying to get. My point is, we've got this little line here. Oh, you know,
We're getting there.
you have your endometrial lining. That's what this is called, the endometrial lining, and we measure the endometrial thickness. If that thickness is less than 4 millimeters, I can look a patient in the eyeballs and say, you know, you're having spotting, you're having some bleeding, but I do not think it is a precancerous or cancerous cell. So if it's less than 4 millimeters, that's super reassuring. And if they haven't had any spotting since that one episode, we're done. Expected management unless you have another episode of bleeding in the future. And then if we notice they have vaginal dryness and those, we can address those things. But yeah, less than 4 millimeters, we're good. We're done. If it's greater than 4 millimeters, it doesn't mean that you have cancer or precancerous cells. It just means we get to do another thing, which means we get to do a biopsy inside the uterus. So that is an in-office procedure that we do, similar to a pap smear. But we put this tiny little straw inside the uterus, and we're able to get a sample inside the uterus. Is it the most comfortable procedure in the world? No.
What's it called?
Endometrial biopsy.
I have had one.
Yeah, it's not super comfy.
But it's not bad either.
feels-
And
it
most people a
literally
little cramping.
Feels like a
Like a bad
teeny
period.
weird pinch.
Yeah.
It feels like the teeniest, weirdest pinch inside of your body.
Yeah.
Like it lasts for literally a millisecond.
And everybody thinks needles, and we're not using any
No.
needles. No needles.
No,
It's a tiny
it
little
is-
catheter with a minimal suction.
And I would argue that it's far less painful and worse than a pap smear.
And how long does it take?
A millisecond.
It's very quick.
It's super quick.
It's a couple minutes. Get a speculum in and wash the cervix off and put the little catheter in, and we're done.
And
That's
you are
it.
done.
Yep.
Yes, you are done.
Absolutely. So we do the biopsy. The biopsy comes back normal. The ultrasound, we've got the ultrasound, whatever that result was. If the lining looked a little thicker or thinner, we still have that biopsy that looks reassuring. If the biopsy looks reassuring or the ultrasound looks reassuring and you're having no subsequent bleeding, spotting, or brown discharge, we can be done.
Yep.
The evaluation is done. I don't know why you had spotting. We'll go, it's probably one of these things, but we are done. However, if you have another episode of bleeding, or sometimes you're just really suspicious that there's a polyp inside the uterus, we'll do a hysteroscopy. And a hysteroscopy is when we put the little camera inside the uterus and we're able to visualize or look at the inside of the uterus.
Yeah.
And then if there is a polyp, we're able to remove it.
Yep. Yep.
Yeah.
So there's a multitude of things to address this situation. It is not like 0 to chemotherapy.
Nope.
It is like
No.
it is like 0 to in-office procedures that range in severity from a nothing burger to something that might be minimally painful, and you may have some sort of cramping, right? So the what we're trying to say is, let's not borrow worry.
Nope.
Right? My mom has told me this for a long time. And that's what we're going to talk about here.
Yeah.
This is what we're going to talk about. We're going to talk about, we're not going to borrow worry, because we are all about not settling and empowering women when it comes to our bodies. Our bodies are going to do what our body's going to do. We can't control this. We can't control it. We cannot control postmenopausal bleeding, but we can control what we do about it.
Absolutely.
right?
Absolutely.
So we're going to go to the office if we
Mhm.
see postmenopausal bleeding.
Yep.
We're not going to ignore it.
Nope.
Mm-mm.
And we are going to address it, and we're not going to let it get worse.
Absolutely. It's not scary. It's actually, these are fun patients
Yeah.
typically for us to see. They're not having fun, but
And sometimes
Um,
people don't even know they're having it, but
Mhm.
we ask them the question when
Absolutely.
they come in.
yeah.
If they're
Yeah.
Which is another good reason to always
Come in.
come in.
Absolutely. And I
Right?
don't know, like maybe I shouldn't say fun. Like it's like usually it's just it's a very gratifying visit
Yeah.
for everyone. And that's why we do what we do, right?
Yep.
And maybe that's why I said fun, because
We have fun.
it makes us
We do.
feel like
But
this is our job and we're doing
Yeah.
a good job.
Right.
Mhm.
Well, a very informative and empowering episode. Thank you so much for joining me. And if you're interested in more episodes about Pelvis Party, please go to rochesterlocal.com/pelvisparty. And thank you so much for joining us.